Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, I'm going to be covering eye and ear disorders. Guys, I want to say a big thank you to you. My podcast has reached 4,000 downloads, so I'm super excited about it. If you're an RN, well, you're in the RN program, or if you're in the program to be a nurse practitioner, I have podcasts available. I've been behind on updating my podcast, but I'm going to get to them soon. I promise. But thank you so much, guys. I hit 4,000 downloads. Also, if you'd like to see me cover more content besides what I do on YouTube, don't forget to check me out on my other social media platforms. I am on Facebook, Instagram, TikTok, and I'm dabbling in Twitter, but I really don't know Twitter that much. You guys know I'm not technologically inclined, but I'm trying to get there so I can reach you young people. Okay, guys, without any further ado, let's get started. First question. Which of the following should the nurse include in the discharge instructions for a client after cataract surgery? Select all that apply. First of all, guys, how do we treat select all that apply? As true or false. That's how you get it right. So let's go. 1, use aseptic technique to apply eye medication. True. Absolutely. Why? Because we don't want that patient to get infection. Remember, guys, after surgery, I don't care what kind of surgery it is. I don't care if it's eye surgery, ear surgery, throat surgery, heart surgery, whatever. Our 3 top concerns are pulmonary embolism / DVT, hemorrhage, then bleeding to death, or infection. So we want to make sure that patient doesn't get infection. You're going to use strict aseptic technique, wash hands, all that good jazz. Choice number 2, expect an increase in pain after surgery. False. You should not expect an increase in pain after surgery. Matter of fact, if you have an increase in pain, so if the doctor told you take, Tylenol or Motrin for pain, and that Motrin or Tylenol is not touching the pain. Matter of fact, that pain is getting worse. There's a possible complication that's happening, and you're going to teach that patient to call the doctor right away. So 2 is false. 3, avoid coughing, bending, or lifting. True. Absolutely. Why do we want the patient to avoid these? We don't want to increase that patient's intraocular pressure. Things that increase intraocular pressure are coughing, sneezing, bending, performing the Valsalva maneuver when the patient's bearing down. We don't want the patient to do any of those. Choice 4, there are no eye drops to use after surgery. False. That is absolutely false. Think about it, guys. The patient just had eye surgery. At the minimum, they're going to get what? Eye drops that are like antibiotics or steroid eye drops or anti-inflammatory eye drops. So they absolutely will get eye drops. And something else I want to point out to you, number 4. What did I tell you about all-inclusives? No, never, avoid, always, only. Do not choose those answer choices unless you know that that's the correct answer. If you have any doubt, stay away from all-inclusive answer choices. Choice number 5, the eye patch will cover the operative eye for 24 hours. True. Absolutely. We are covering that eye for 24 hours because we want to protect that eye. We want to protect it from injury. We want to make sure that particles such as dust doesn't get into that eye. We want to make sure that patient doesn't accidentally rub that eye and cause trauma to the surgery site. Okay. So for this question, the correct answer choices are 1, 3, and 5 because they are true. Moving on. Which of the following should the nurse include in the assessment of a client's cranial nerves and extraocular muscles? 1, red reflex. 2, 6 cardinal fields of gaze. 3, disc characteristics, I can't speak. Or 4, macular characteristics. And guys, the correct answer is 2, the 6 cardinal fields of gaze. By the way, if you go back to the question, look where it says the cranial nerves. The cranial nerves that we're assessing when we're doing the 6 cardinal fields of gaze is cranial nerve 3, 4, and 6. That's what we're testing, okay? And then the second part where it says extraocular muscles, those muscles when you're looking up, down, left, right, side, like this, right? You're not moving your head, you're just moving your eyeballs. That's your 6 cardinal fields of gaze. Now let's look at the wrong answer choices. Choice 1, red reflex. Choice 2, disc characteristics. And choice 3, macular characteristics. Those actually inspect the internal eye. not the extraocular eye muscles. Those inspect the internal eye. So that's why number 2 is the correct answer. Next question. When completing a measurement of the client's visual acuity, which of the following would be appropriate? 1, ophthalmoscope, 2, pen light, 3, visual field, or 4, Snellen chart. And guys, the correct answer is 4, Snellen chart. By the way, whenever you see or hear visual acuity, automatically I want Snellen chart to come to your mind, because usually when they ask about a visual acuity, they're really asking you about the Snellen chart. That Snellen chart, or the E chart, that is what measures a patient's visual acuity. How well can they see, right? Ophthalmoscope and pen light, that actually illuminates the inner eye. So it puts a light to the inner eye, but it doesn't measure the visual acuity. Choice 3, visual field, that actually evaluates the cranial nerves, but not visual acuity. That is why number 4 is the correct answer. The nurse collects a history from a client suspected of sensorineural hearing loss. Which of the following findings supports the diagnosis and should be reported? 1, the ability to hear high-pitched sounds. 2, frequent ear irrigations for hard, dry cerumen. 3, a history of exposure to excessive noise over a period of time. Or 4, the client's ability to speak softly. And guys, the correct answer is 3, a history of exposure to excessive noise over a period of time. So guys, let's talk about this. That word that I can never pronounce. There are lots of words I can't pronounce, guys. The sensorineural hearing loss. When a patient has this, guys, this is irreversible hearing loss, right? They lost it and we can't get it back. And what would we see? What type of history would the patient have that could cause that? It would be something like Meniere's disease, right? Or the aging process, or maybe the patient took some type of medication that caused ototoxicity. Those type of conditions would cause the patient to have sensorineural hearing loss. So that's why number 3 is the correct answer. Which of the following nursing measures should receive priority in the client's plan of care after eye surgery? 1, prevent increased intraocular pressure and infection. 2, instruct on the importance of follow-up. 3, instruct on how to perform the Valsalva maneuver. Or 4, pain management. And guys, I know you all chose the correct answer. Number 1. Prevent increased intraocular pressure and infection. That is going to be a priority. First of all, again, any type of surgery that a patient has, you want to make sure they don't develop a DVT or pulmonary embolism. You want to make sure they don't hemorrhage to death, and you want to make sure they don't develop an infection. And in the case of eye surgery, one of the biggest concerns we have besides those 3 is also, guys, intraocular pressure. We don't want to do anything that will increase that patient's intraocular pressure, such as bearing down because maybe they're constipated, or sneezing, or coughing, or bending at the waist. Anything that increases intraocular pressure, we want to stay away from. Now, let's look at the other choices, guys. Choice 2, instruct on the points of follow-up. Yes, that's important, but it's not a priority like infection and intraocular pressure is. Choice 3, instruct on how to perform the Valsalva maneuver. No, we're not. Absolutely no, we're not. We don't want them performing the Valsalva maneuver because that will increase intraocular pressure. Choice 4, pain management. Yes, we want to teach them pain management, but pain is not a priority in this situation, guys. Whenever you're being asked about a priority, you have to think about the patient's physiological integrity. What will physically keep the patient alive the longest, or what can physically kill the patient the fastest? That is going to be our priority, okay? The nurse should consider which of the following drugs taken by a client with glaucoma. 1, increase intraocular pressure. 2, decrease intraocular pressure. 3, decrease vitreous humor. Or 4, cause anesthesia. And I don't like the way this question was worded, but the correct answer, guys, is 1, increase intraocular pressure. That is the medication that you would question as a nurse. Think about it. What is glaucoma? Increased pressure in the eyeball. So why would you want to give a drug that would make that pressure go even higher, right? So it makes sense. That's the correct answer. Now let's look at the other choices. 2, decrease intraocular pressure. That's a drug that we actually would give to treat glaucoma to make that pressure go down. 3, decrease vitreous humor. That's something we want to see. Matter of fact, the more decrease we see in the vitreous humor, excuse me guys, the more decrease we see in the vitreous humor, the more decrease we actually see in the pressure, because the whole reason that patient has all that pressure in the eyeball is the buildup of the vitreous humor, okay? And choice 4, cause anesthesia. That really doesn't directly affect the pressure in the eyeball. So the correct answer, guys, would be number 1, increase intraocular pressure. We're going to be like, wait a minute, what's going on? We're not going to give this medication, right? So number 1 is the correct answer. The nurse implements which of the following interventions to reduce intraocular pressure following eye surgery? 1, applying hot compresses. 2, providing bright lighting in the room. 3, applying gentle pressure on the affected eye. Or 4, keeping the head of the bed elevated. And guys, the correct answer is 4, keeping the head of the bed elevated. 1, that elevation, gravity is going to help to drain that aqueous humor. Number 2, keeping that head elevated. Remember, one of the things that can increase pressure is the lower that patient's lying down, their head is, the higher the pressure will go. So we want that patient's head elevated. Now let's look at our wrong answer choices. 1, applying hot compresses. Actually, we want to apply cold compresses to help decrease that pressure. 2, provides bright lighting in the room. Actually, guys, we want dim lighting in the room. 3, applying gentle pressure on the affected eye. Do we want any pressure on the eye? This is a patient that we're trying to decrease pressure. Why would we put any type of pressure on that patient's eye? Does that make any sense? No, it does not. So that is clearly the wrong answer. The correct answer, guys, is 1, keep the head of the bed elevated. Okay, guys, next question. The client who just had cataract removal complains of nausea and severe pain in the operative eye. Which of the following nursing actions is a priority in the client's plan of care? 1, administer drugs for the pain and nausea. 2, notify the doctor immediately. 3, ask the client assure the client that this is normal after surgery. Or 4, turn the client to the operative side every 2 hours. And guys, the correct answer is 2. You are going to call the doctor immediately. What is the one word in that question that made us know that this is an emergency and we have to do something right away? Severe. What did I tell you guys about that word severe? Remember when I gave you guys the list of the patients who are priority? Those are patients you're going to run to right away. Was it severe on that list? Absolutely was. How do I know it was? Because I'm the one that told you. Okay? Not pain. It didn't say pain. What did it say? It said severe pain. That lets you know there's a complication going on. What are we suspecting? We're suspecting increased intraocular pressure, and we have to call the doctor right away. That patient may have to go back into the operating room, back into surgery. Now let's look at our other choices. 1, administer the drugs for pain and nausea. This shows that you have no idea what's going on. You don't even recognize that there's a possible ocular emergency happening, and you're just going to give that patient pain med when it said severe pain, right? Choice 3, assure the client that this is normal after surgery. Oh my gosh, you're a killer nurse. You're going to make your patient lose their sight. Absolutely not. You're not going to do that. You have to recognize something's wrong here. Choice 4, turn the client to the operative side every 2 hours. No, we will not. You turning that patient to the operative side, you want to know what that's going to do? That's going to increase the ocular pressure. And we're trying to do what? Decrease the ocular pressure. So guys, the correct answer is 2. You're going to call the doctor right away. The client received instructions following cataract surgery. Which of the following statements by the client indicates the client understood the instruction? 1, aspirin's all I need for soreness. 2, I'll sleep on the operative side. 3, I'll wear an eye shield at night and glasses during the day. 4, I will not lift anything over 15 pounds. And guys, the correct answer is 3. I'll wear an eye shield at night and glasses during the day. Remember, guys, we want to protect that operative site. We want to make sure pathogens, dust, sand, dirt, nothing gets in there. We want to make sure you don't accidentally rub that area and cause trauma to that surgical site. We want to protect it. So that's why number 3 is the correct answer. Now let's look at our wrong answer choices. 1, aspirin's all I need. What did I tell you about all inclusives? All, always, never, only, none, no, right? We don't choose that as an answer choice unless we know that we know that we know that's the correct answer, and that's not the correct answer, right? By the way, remember, aspirin has what kind of properties? What can it make the patient do? Bleed. And one of our concerns after surgery is what? Hemorrhaging to death. So we don't want to give them anything that can cause them to bleed. Remember, after surgery, we are concerned about what? DVT or pulmonary embolism, infection, or hemorrhage. So we're not going to give them aspirin. Wrong. Choice number 2, I will sleep on the operative side. Well, I already told you putting the patient on the operative side will increase ocular pressure. Do we want to increase ocular pressure? Absolutely not. So we know that's wrong. Choice number 4, I will not lift anything over 15 pounds. Look how they try to trick you. I love questions like this because I used to write questions like this. Remember what I told you? If the whole thing is not right, the whole thing is wrong. No matter how beautiful that answer may seem, if one word in that answer choice is not correct, the whole thing is wrong. I will not lift anything over how many pounds, guys? 5. Nothing over 5 pounds. So as much as you are tempted to choose that, because it said 15 and not 5, it's wrong. And the correct answer choice is number 3. Because the client has glaucoma, plans for nursing intervention should include 1, a decrease in fluid intake, 2, avoiding reading and watching television, 3, a decrease in the amount of salt in the diet, or 4, eye medications must be taken for life. And guys, the correct answer is 4. Eye medications must be taken for life. Let me tell you something. When it comes to glaucoma, you have to teach the patient, and these glaucoma medications, they're expensive, guys. They are expensive, but you have to be very clear when you're teaching your patients, and you tell them, if they do not take their glaucoma medications the way they're supposed to, they will lose their eye. It's not a question of if. They will lose their eye. When I say the eye, they're not losing their actual eyeball, but they will lose their sight. They will go blind. Glaucoma medications are one of those medications you absolutely must take if you care about your eyesight. Okay, so that's the correct answer. Choices 1, 2, and 3, decreasing fluid intake, avoiding reading, watching television, decreasing the amount of salt in the diet. None of those decrease the intraocular pressure. But the anti-glaucoma medications do decrease intraocular pressure, and that can save the patient's eyesight. Which of the following assessments indicates a client has sustained a retinal detachment? Select all that applies. How do we treat select all that applies? As true or false. So before we get into it, guys, let's talk about retinal detachment very much. Let's talk about retinal detachment very quickly. So retinal detachment, guys, is when the retina actually detaches from its blood source. Remember, guys, your eyeballs, your kidneys, your liver, your spleen, your heart, everything, every single organ, your brain, every single organ in your body needs blood to survive, because the blood is what carries the oxygen, vitamins, nutrients, minerals that those organs need. So imagine your retina detaching from the actual blood supply. That's what happens in retinal detachment. And that's why retinal detachment is a medical emergency. That patient can lose their eyesight. Okay? So anyway, the question says, which of the following assessments indicate that a client has sustained a retinal detachment? Select all that apply. 1, floaters. True. The patient often will say that they see floaters in their visual field. True. 2, a sharp, sudden pain in the eye. False. And that's one of the reasons retinal detachment is so dangerous, because it is painless. The patient won't feel it. Choice 3, photopsia. True. Those are light flashes. The patient will report seeing light flashes. 4, a reddened conjunctiva. False. Okay, if the patient doesn't have conjunctivitis, they don't have an infection, they're not going to have a reddened conjunctiva. 5, a glare that's worse at night. False. 6, ring in the visual field. True. And by the way, the patients will report seeing rings in the visual field. Sometimes they'll say they see cobwebs. They'll call them cobwebs. And sometimes they'll say that they lose their peripheral vision as well. Okay, all of those are signs and symptoms of retinal detachment. So the correct answer for this, guys, is number 1, number 3, and number 6. The nurse implements which of the following in the plan of care for a client who's hearing impaired? 1, speaks in a raised voice. 2, speaks slowly. 3, uses exaggerated facial expression. Or 4, has the light behind the nurse. Oh, guys, I said vision and hearing, but we also, this is hearing. Don't listen to me. I don't know what I'm talking about. Okay, guys, so the correct answer is number 2, speak slowly. And here's the thing. You want to speak slowly and in a normal tone. So do you see how I'm speaking to you? Do you see how I'm enunciating my words? I'm doing that so as I'm speaking to you and you're hearing what I'm saying to you, you can see my lips as I'm enunciating my words. And so sometimes a patient, as they're listening to you, they may also want to look at your lips. Okay, you don't want to speak in a high tone because especially the elderly, as they get older, the geriatric patient, they can hear deeper tones, lower tones better. It's harder for them to hear high-pitched tones. So you don't want to speak in a high-pitched tone. You don't want to speak quickly, okay? And sometimes it might help if you lean in and speak in the patient's good ear, okay? So guys, number 2 is the correct answer. The nurse correctly tells the nurse correctly tells the client that the priority goal in the treatment for Meniere's disease is to 1, maintain sodium-free diet. 2, eliminate environmental noise. 3, preserve the remaining hearing. Or 4, promote a quiet environment. And the correct answer, guys, is number 3, preserve the remaining ear. So guys, Meniere's disease, this is a disease of the inner ear, and this also can cause that sensorineural, I can never pronounce that word, sensorineural loss or neurosensoral. I think neurosensoral, maybe sensorineural, but that word, that can cause that patient to have permanent hearing loss. Okay, so our priority in this case with Meniere's disease, and by the way, Meniere's disease, that's when that patient has vertigo, so they constantly feel like the room is spinning, and that could put the patient at a fall risk. That's going to be our priority before anything else. We want to preserve that patient's hearing because once they lose it, it's gone, right? So that's going to be our priority for that type of patient. Which of the following is the priority for the nurse to include in the teaching plan for a client with acute bacterial conjunctivitis? 1, instruct the client to avoid rubbing the eyes. 2, apply hot, moist compresses to adherent crust on the eye. 3, stress the importance of hand washing. Or 4, instruct the client to avoid sharing towels. Okay, guys, what is the number 1 means of infection prevention? Washing the hands. And it seems so easy, right? I promise you guys, I cannot, if I had $1 for every time this question was asked on NCLEX. And as students, you get so scared and nervous and you don't want to choose it because you feel like it's too easy. That's the answer. That is always the answer. The number 1 way to prevent infection is washing the hands. That's the correct answer. Next question. The nurse assesses a normal intraocular pressure to be what? And guys, you absolutely have to know this number. What is your normal range for intraocular pressure? The correct answer is 10 to 21. Anything higher than 21, that patient has increased intraocular pressure. You absolutely must know that number. Please commit it to memory. The registered nurse is making out assignments for the day. Which of the following nursing care activities may be delegated to the certified assistive personnel? 1, instruct the client how to instill artificial tears. 2, inform the client with cataracts of the postoperative care. 3, assess the client for hearing loss. Or 4, reinforce to a client with bacterial conjunctivitis the importance of hand washing. And guys, the correct answer is 4, reinforce. What's another word for reinforce? Remind, okay? Unlicensed assistive personnel, such as a CNA, they cannot EAT, they cannot evaluate, they cannot assess, and they cannot teach. What they can do is remind. Mr. Such and such, remember the nurse said to drink plenty of fluids. Mr. Such and such, remember the nurse said to elevate your legs. They can remind. And so out of this list, guys, 4 is the only thing that CNA can do. The nurse evaluates which of the following assessment findings to be normal in an older adult client. 1, a hordelum, 2, exophthalmos, 3, presbyopia, or 4, tinnitus. And guys, the correct answer is 3, presbyopia. That's that farsightedness. No, not farsightedness. As and this is normal part of aging. As the patient gets older, they have farsightedness, right? And that's why you'll see, even just to read newspaper, they'll need what? Those glasses that they'll pick up from Walgreens or Publix, or they'll get those bifocal glasses. So 3 is the correct answer. Now let's talk about the other choices. 1, hordelum. That's an infection of that sebaceous gland of the eyelid, okay? 2, exophthalmos. That's the protruding of the eyeballs. You see that in patients with like hyperthyroidism. Choice 4, tinnitus. That's ringing of the ears, and we see this often in patients that have toxic levels of certain medications, such as acetaminophen, okay? So for this question, our correct answer is number 3. And guys, we are already down to our last question. The registered nurse is preparing to delegate clinical assignments on the medical surgical nursing unit. Which of the following assignments would be appropriate for the nurse to delegate to the licensed practical nurse? 1, instruct the client on the postoperative care following surgery for cataract. 2, develop an activity schedule for a client with glaucoma. 3, perform an assessment of the ears for a client complaining of tinnitus. Or 4, administer a drug intranasally to a client who has allergic rhinitis. And guys, the correct answer is 4, administer a drug intranasally to a client who has allergic rhinitis. If you haven't watched my video on priority and delegation yet, please, excuse me, make sure you watch it. I go in depth, and it really helps you understand what kind of patient you're going to delegate to who and in what appropriate circumstance, okay? You always want to give the most routine med to the most stable patient to the LPN or the floating RN or the graduate nurse. Okay, but any patient that requires a care plan, the creation of a care plan, any patient that requires in-depth assessment, any patient that requires in-depth teaching, the RN is going to get that patient. You're not going to give it to an LPN. And that's why choice number 4 is our correct answer. Guys, I hope you found this video to be helpful. If you want to see more videos on this topic, please let me know in the comment section below. One thing I noticed, I think this is my 3rd video on eyes and ears, but I don't think I've done anything on nose and throat yet. So I think I have to add that on my to-do list. But like I said, if there's anything you'd like to see me cover or cover more of, go ahead and drop it in the comment section. You'll give me some ideas of new videos to come up with. Don't forget, guys, I'm on the other social media platforms, and what I cover there is different than what you see here on YouTube. So if you want more content, check me out on TikTok, Instagram, Facebook. Don't forget, guys, I also have my podcast. I cover information for RN students and nurse practitioner students. I'm a little behind. I admit that. I have not posted in a minute, but I promise, guys, I'm getting back to it. But if you haven't checked it out yet, be sure to check that out. I'm on every major streaming platform. One more thing. Oh, my audio lessons. If you guys can't get enough of my teaching, I have so many students. They say to me, literally, when they're taking the test, they can hear my voice. And when they're about to choose the wrong answer, they can hear my voice telling them, you better not. Right? If you're one of those students and you really want more in-depth teaching, check out my website. I have audio lessons available where I go over this stuff in depth, and I give you what you're most likely going to see on your next test about this information. How do I know? I used to write these exams. I know what NCLEX is looking for. And at the end of the day, your school wants you to pass the NCLEX, because as you pass the NCLEX, their numbers go up and they won't be in jeopardy of shutting down, right? So they're preparing you to take the NCLEX. So the type of content they're going to give you is the type of content that NCLEX is looking for. And I know what NCLEX is looking for. So if you haven't done so already, check out my website, nexusnursinginstitute.com. Check out the audio lessons available. I have new lessons posted. It used to be every week. I've gotten busy, so about every month, but check it out if you have a test coming up. See if I have something on there available for you. All right, guys, don't forget my videos get posted every week, Sunday at 1 p.m. I have new content for you. Thank you so much, and you'll see me next week.